Welcome back to the Bluffton News. Dr. Faith Polkey is here with me now, and she is the interim medical officer. Did I get that right? For the Beaufort, Jasper County Health Services Compound. She's also a pediatrician and preventative health care worker. So we have a lot to talk about this morning, Dr. Faith, and we are going to jump right in with kind of getting to know this Omicron virus a little better. Tell us a little bit about what's going on there and what symptoms we should be looking out for.
Right. So the Omicron variant, first noted in December here, and we are definitely seeing, I guess the word is exponential cases of it over the last 2 to 3 weeks. Mostly what we're seeing is people coming in with complaining of sore throat. Okay. They'll say, I have some sinus congestion. I thought my sinuses were acting up or my allergies were acting up. And then it usually progresses from there. People will get some of the similar symptoms: cough, congestion, runny nose. There's some fever with it, some chills. Okay. A new symptom that people are saying that we didn't see with previous variants are night sweats. So they're waking up drenched at night in sweat. And then GI symptoms, so some vomiting, diarrhea.
Okay. Well, that's all lots of fun.
Great.
So, yes. And here we are still talking about it, right, almost 2 years later. But tell us what we can do. Obviously, we've all been with the mask protocols and washing our hands and hand sanitizer and things like that. And how can we, as this presents in this new form, are we still doing those things? What else can we do to keep ourselves safe and to keep our family members safe?
Right. So I think the main thing is recognizing that you either may have been exposed or that you could have symptoms, because it's still important for people to isolate. I know the CDC just came out with new guidelines, and we can talk about that a little bit more, but it is really important for people to isolate themselves away from others, especially if they're going to work or going to school, so that we can decrease the spread. I know there's been a lot of talk about this being a milder form, but people are still getting hospitalized. We're still seeing deaths from it. And so it's still, for some people it may be mild, but for others it can be a lot worse, especially people who are immunocompromised or young children. We're definitely seeing young children with increased rates of hospitalization. So we still have to be very careful.
Okay. Well, and let's do touch on that, the guidelines that the CDC just kind of reduced to 5 days isolation, then in 5 days with a mask. How are you feeling about that recommendation? Or are you still kind of back on the old protocol where it's more like 10 days?
Yeah, so I will admit that makes me uncomfortable. Okay. But if you look at the CDC guidelines, it says people who are asymptomatic. Yes. At 5 days. So there's two different places. There's people who are healthcare workers, and then there's the general public. So the general public, they're saying at 5 days, if you're feeling better, symptoms are getting better, you can go out, but you need to wear a mask for days 6 through 10, right?
Right.
For healthcare workers, though, there's still the guidelines for it to be a little longer, because we're people who work with, vulnerable patient populations. So the conventional is that, if you're feeling better, you're asymptomatic at the 7th day, you can test. I think they moved that back to 5 days also. But some healthcare organizations are really having difficulty with staffing, and they've had to go to contingency guidelines where they do the 5 days also, because otherwise you wouldn't have anybody available. Right. And if somebody's asymptomatic and they're not having symptoms, maybe less likely to shed virus, then if they can wear a good mask, not a cloth mask, not even a surgical mask, a good KN95 or N95 mask, that will help reduce the transmission.
Well, we've got just under a minute left, but I do want to touch on testing. And so when does somebody must get tested? I mean, obviously, if you're symptomatic, I know that you want to get tested. But if somebody is asymptomatic but may have been exposed, when should they be going to get tested?
Yeah, so if someone's been exposed within the first 5 days, you should get tested. So usually we say test, immediately when you've been exposed, to make sure you're not the one that was positive, right? Right. But within the next 5 days, if you remain asymptomatic, you should get tested at that 5th day to just make sure, because by then you should have, if you were going to test positive, you probably would have tested positive. Okay. So. Excellent. Very important with exposures to still get tested.
Yes. Well, thank you, Dr. Faith, for being with us. All great information. We appreciate it so much.
No problem.
A few weeks ago, we had a chance to meet the new executive director for Second Helpings. We're going to take a look at that interview again next.